Hi, I'm Dr. Mark Halstead. I wanted to talk to you a little bit about the clinical report that we're releasing today about returning to learning from a concussion. So, as you all know, there was a clinical report we actually put out in 2010 that talked about sport-related concussions in children and adolescents that focused a lot on managing these kids and getting them back to return to play. But one of the things that was a little bit neglected in that particular report is how do we get these kids back safely to the classroom? And that's an area of emphasis that I think we really need to make, because we know that these kids struggle with physical symptoms, but they also struggle with cognitive symptoms as well, and that can really have a big effect on them in the classroom setting. So basically what the report talks about, it gives some guidelines to pediatricians as far as what kind of things could you implement in your practice to help this child getting back into the classroom safely. Some kids may have severe symptoms that they need to be out of the classroom for a particular period of time. Some kids may be able to go back to school with various adjustments, and we talk about some strategies in the report on how to do that. So I think one of the other parts of this particular report that we use is we have things in terms of team settings. We don't want this to make this complicated for pediatricians in the sense that we don't have to have these actual true teams put into place, but we actually assign basically people to various teams that could be helpful in the recovery of this particular kid. And so, as an example, the pediatricians would be part of the medical team. They could actually manage some of the medical symptoms that they may be having. There's a family team, so the parents and caretakers can take care of this child at home. And then we have two teams related to schools, and there are various individuals in those school settings who may be able to help assist this child when they get back to school. And a lot of kids can go back to school after they've had a concussion. They may need some adjustments. So as an example, if they're really sensitive to bright light, say a school has smart boards as an example, they can adjust brightness on those to help them out. Some kids may need extended time to be able to do tests. They may have the need to actually reduce the amount of homework that they do. If they're having a lot of troubles with sensitivity to noise, they may actually have to wind up going and having lunch in a quiet area or not being a band or a music class as examples. And so we wanted again to provide a framework for this because we think this has been kind of a long neglected area. We talk so much about getting athletes back to play. The problem is that concussions don't just happen in sports, and a lot of these kids can really have a significant problem in the classroom, enough so that it can actually significantly worsen their symptoms. And so we wanted to make sure that we're addressing that as well, rather than just getting back onto the field.